Welcome to another episode. Today is an exciting one. We have Victoria, who is a dental hygiene and therapist, and she's going to be telling us about her route into the career, her experience at university, as well as the practicalities of being a dental hygienist and therapist. So, whether you're an aspiring hygienist and therapist, whether you're a student, or whether you're newly qualified hygienist and therapist, you're going to find nuggets from this episode. You have all been asking me questions about dental hygiene and therapy, so this video is going to help to answer those. In the recording, only Victoria's camera was recorded, so you will hear my voice, but you won't see my face. But I'm sure you'll still get a lot of value from this episode. I'm excited today because we get to talk with somebody who is working as a dental therapist, and she's going to be sharing all her golden nuggets about, getting into the course and working effectively and shining as a dental therapist. She's won several awards, and we'll get into that. So it's my pleasure to have Victoria join us today. Victoria, thank you for being on here with us
Thank
today.
you for having me, Arnold. I appreciate it.
So Victoria, if you could just let us know, where are you based? Where are you working? Where do you live? Let's start there.
Yeah, absolutely. So I am currently based in London, which is where I'm from, working across three practices, a combination of mixed NHS and private, and fully NHS, pretty
Yeah.
much, which is a contrast to where I studied up north in Manchester, but I'm back down south in London.
All right. So, being a dental therapist, a lot of people won't know exactly what that is, what that entails. I'm sure even some people within dentistry still struggle to fully know what is involved with being a dental therapist. When people ask you, what do you do? How do you approach that?
The easiest way that I explain the role of a dental therapist, I tend to say we do the role of a dental hygienist. So we treat gum disease, we take x-rays, we do teeth whitening, and we also do some of the role of a dentist. So we do restoration, so fillings, we take primary teeth out, as well as diagnose tooth decay and treat it accordingly, plus many other things. But I think that's just the short and sweet of it.
Yeah. All right. Fantastic. Now, thanks for that summary. I'm sure it's going to help a lot of people that are listening in. What would you say would be the best way for somebody to identify whether going into being a dental therapist is the route for them or not? What might be your advice and somebody who's considering their career options? Maybe they're in doing their A levels and they're thinking about it.
Yeah, really good question. I think fortunately there's so many resources available now online. There's so many like a day in the life of a dental therapist, come to work with me, stuff like that. So there's
Yeah.
many ways to get the full insight to what the role entails,
Yeah.
um, as well as going to shadow, get work experience. I remember when I was doing my A levels, getting dental work experience was very difficult.
Yeah.
I know it's become even more difficult with practices still following along with COVID guidelines, and it's quite difficult to source work experience. But if you can, I'd always suggest that because just being in the thick of it and being immersed in it is really invaluable.
Yeah.
You're able to see both the good, the great, rewarding sides, but also the challenging sides
Yeah.
of things. As a dental therapist, you have to be able to work under pressure, be able to prioritize. So, getting different part-time roles, being yourself, putting yourself in different situations, whether that's volunteering, which is going to be able to test you and see whether, you are able to work under pressure, how good are you working in a team? Because in dentistry, no matter how big or small the team is, you're going to work in a team. So
Yeah.
are you someone who enjoys working in a team? Are you someone who prefers to work solo? Little things like that, I'd say is the
Yeah.
best way to suss out whether it's the career for you.
Yeah. And for yourself, what was the thing that made dental therapy the course for you to apply to? Were you considering other options outside of healthcare? Was it always going to be something in healthcare? How did you get to that?
So I was always very good at science. Naturally, I was very good at science, and I've always been a people person. Always got involved in school activities. I was the head girl of my secondary school. So, for a long time, it was kind of weighing up, am I going to do medicine? Am I going to do dentistry?
Yeah.
Um, fortunately enough for me, I was really fortunate to get some work experience with a dental technician,
Yeah,
and I was there making like occlusal rims and
yeah,
dentures, and that kind of opened things up to me and just seeing, just how vast dentistry is. And
mhm,
then I got some work experience, fortunately, observing, shadowing at a dental practice. I was like, okay, this is nice. You're really able to balance both, the science plus the people
yeah,
uh, mingling side of things.
yes,
So that was kind of my entrance into it.
yeah.
So yeah, that was pretty much for me. Mm.
And if someone has made that decision that they do want to apply, what's the best way for them to be a competitive applicant? So you've mentioned work experience in
Yeah.
helping them to make sure that that's the right career choice for them and volunteering. But
Mhm.
academic side as well as non-academic, what would you say are the things that make you a competitive applicant to get in?
Dental therapy has become increasingly competitive over the years. Historically, a lot of dental therapists started off as dental nurses and then would train to become dental therapists. However,
Yeah.
majority of applicants now are A-level leavers, school leavers. So A-levels are quite a big part of the application process. So I
Mm,
believe the majority of universities are looking for a minimum of three Bs. Some is like an A and two Bs, some is two As and a B, but it varies from university to university.
yeah.
And so the choice of subjects, you definitely need biology. If you could have chemistry as well, that's also going to be strong.
Yeah.
But generally just having those subjects. I think some universities also consider applied sciences,
Okay.
access courses as well, which will be science based, and upon successful completion, going into the course. So I'd
Okay.
say that's the main thing, making sure you've got the right A levels,
Yeah.
those minimum entry requirements, as well as showing that you're a well-rounded individual, volunteering, work experience, having a real understanding of what dentistry entails,
Yeah.
familiarizing yourself with the scope of practice as well.
Yeah, I've currently got two trainee nurses at my practice, and one of them has expressed that she wants to go on to do dental therapy. And it's interesting because you said that traditionally it was nurses that ended up going to dental therapy. I do think there is a value in that because you really get to see the job up front.
Yeah.
All the positives, all the negatives, and you really cement whether it's the right job for you. So it's interesting that you pointed that out. And yeah, my nurse is currently doing that as well. Um,
Fantastic.
so the course itself, are they 3 years, 4 years? What the course is structure? What's the course structure like? Maybe if you give us a flavor of what Manchester was like for you.
Yeah, definitely. So, majority of courses now are Bachelor of Sciences, so BScs, which are 3 years.
Mm,
There are still some courses, I believe Cardiff. There's a few more places that offer it as a diploma, which is 27 months. But majority of universities have moved to the 3 year BSc,
mm,
which is great because I do think it enables you for more options, postgraduate study, um, things like that. So yeah, 3 year course is what I did, Bachelor of Science at the University of Manchester. And fortunately, we were trained alongside the BDS dentist, trainee dentist that was studying. So
mm.
from jump, we were learning about teamwork, a cohesive team working environment, referrals. Um, we started off with doing, I must also mention, a lot of the courses are merged with hygiene and therapy. So you get the dual qualification. You're qualified as a hygienist and as a dental therapist. So we
Yeah,
started initially just getting into grips with treating gum disease, diagnosing gum disease, BPEs, things like that. And then very quickly on, we progressed onto restoration. So while our BDS colleagues, our dentists, were starting to work on dentures, we were starting to work on restorations.
yes,
So from class one all the way to class five. And yeah, we always spent a lot of time in that first year in the clinical skills lab on Phantom Head,
yeah,
doing a lot of practical work. What
yes.
made Manchester really appealing for me was the anatomy side of things, was that we got to work with cadavers. So we were taught the theory about, this is where the carotid artery is and, the nerves and all the different systems, but to actually see it in a human body, I think was an invaluable experience for myself just to be able to visualize it. I'll be
Yeah,
honest, it was a little bit daunting at first, but, you
yeah.
get used to it. And I think, it's really, really fortunate that there are many people who are willing to, volunteer their body for further learning and students. So, yeah.
Yeah, no, as part of our training at UCLan Dental School, we got to, I think it was Liverpool. We got to go to Liverpool
Ah,
hospital, and they're the cadavers there as well. The cadavers are, people that have passed away, and they've contributed their bodies for research and for clinical things like, education as well. So, yeah, like Victoria's saying here, it's a great way to be able to learn about human anatomy, not just from a textbook, but from an actual human body. So yeah, no, definitely. How were you with that?
prior to the first anatomy lecture,
Yeah,
I was really dreading it. I'll be honest, because
yeah,
also my mind was creating all sorts of images. But
yeah,
once you got there, I think the bodies are so well preserved, and you're just there to learn.
yeah,
Um, what did stick with me was the smell. The smell, because there's so many things that are required into preserving a
yeah,
cadaver. But no, it was just a really good learning experience. I didn't
yeah.
faint or anything like that. I was quite enthusiastic about it. Yeah.
Yeah. One thing you pointed out as well is that you're dually qualified. So let's just go in a little bit into that because that can cause some confusion as well. So if you're tying to that, you say you're dually qualified. You said as a hygienist and as a therapist as well. So just talk to us about the distinctions between those roles and being dual qualified. Yeah.
Yeah, absolutely. So, as a dental hygienist, the main, I'd say, meat of my role as when I'm working as a dental hygienist is, I'd say, gum disease treatment. So, whether that's from quite mild gum disease to really extensive gum disease, as well as things like stain removal, cosmetic stain removal, teeth whitening, and things like that. The difference between a hygienist and a therapist is the slightly more extended scope of a therapist. So that
Mm.
being the ability to restore teeth, to cut teeth tissue. So doing things like fillings, whether that's white, silver, front teeth, back teeth, adult teeth. Also being able to take teeth out, which
Yeah.
the scope of a hygienist does not include. So
Okay.
a dental therapist can do the full scope of a hygienist plus a little bit more. So if you are a therapist, you can also work as a hygienist, but hygienists cannot work as therapists. So it's just that distinction. So some people, they just fall in love with the hygienist scope and work exclusively as hygienists post qualification. Others, such as myself, who's very passionate about restorative dentistry, really love working as a therapist.
Can you go onto a course that's purely for becoming a hygienist, or are all courses going for the dual qualified approach? How are things at the moment with
Things at the moment, they're a little bit different. So most courses are the dual qualification. But there are some universities, as I mentioned, I believe Portsmouth and Cardiff still offer hygiene only. So if you are
okay,
only interested in, and I think maybe Essex as well, but don't quote me on that.
okay,
If you are interested in only becoming a hygienist, then yeah, there are those routes. And I do believe those courses are slightly shorter.
yeah,
So it's not the 3 years, but it is a diploma as opposed to a Bachelor of Science, BSc.
I see. And do you get the dual qualification at the end of, let's say, the 3 years, or part way do you get the hygienist qualification, and then when you finish the 3 years, you get the therapist? How does that work?
Yeah. No, so it's upon completion, you get both qualifications. Yeah. So
Okay.
upon completion, you get your due qualification, register with the GDC, and yeah, you're good to go.
All right, fantastic, fantastic. And just tell us a little bit about your journey once you had qualified. What were you feeling? What was it like, the first job that you had, even finding the first job?
Yeah. So I was very fortunate to get onto a dental therapy foundation training program. So just like dentists do upon qualification, they do a mandatory 1 year training. For therapists, it's not mandatory yet, but I would strongly advise it to any therapist who's newly qualified or about to qualify. It's open to candidates up to 2 years post qualification. So even if you've
Mm.
graduated, you can still go on to do the training program. That to me was excellent and such an invaluable experience because I was working alongside a foundation dentist. So he was referring to me. I really had the full experience of what it is to work as a cohesive team in general practice.
Yeah.
Prior to, I think it was 2002, dental therapists could only work in hospitals. So
Mm.
um, it's taken a little bit of catch-up time, even though it was over 20 years ago since that law had passed, but it's taken a bit of catch-up time for general dental practices to incorporate the dental therapist within practice. So it was really great to be able to experience that. I had not one but two trainers that I was able to lean on. So if you feel a little bit challenged or there's anything you want to ask during treatment, you could just say to the patient, just bear with me one moment, I want to get a second opinion. Trainer will pop in, have a look, see what they think. If they feel they need to, if you want them to intervene physically, then they can. So it was a really great experience, I must say, and I'd recommend it to anyone. I think in London as well, it's quite difficult to get a role as a dental therapist. There's a plethora of opportunities for working as a hygienist, but I think if you have that foundation training, it just gives you that confidence, and also makes you a bit more of a standout candidate when applying for jobs. I think a lot of therapists who don't do it, unfortunately, because they're nervous, they
Yeah.
de-skill, they shy away from it, and then they quickly find themselves working exclusively as a hygienist.
Yeah. I guess a bit of a selfish question for me is I'm looking at getting more staff and dental therapies, one where I'm also hiring. What makes for a good experience for a dental therapist at a practice? What sorts of things make it for a great working environment?
Yes, I would say just the team fully understanding the scope of a therapist. So small things like the receptionist and the admin team referring to the dental therapist as a dental therapist rather than just the hygienist. So there's no confusion. It opens up a conversation for patients who most times haven't heard of a dental therapist, to understand that, okay, this is what the therapist can do. They can do the fillings, and if you need anything more, they'll refer you on to the dentist. Um, I'd say also just having great equipment as well.
Yeah.
I love doing composite work and having small things like a composite heater in
Okay.
practice. That just makes my life so much easier, seeing that composite just flow smoothly into that cavity. Um, and yes, I'd say also just having a good support system. So open door policy. So in one of my roles, when I was getting back into that, I went through a period of time when I was not using my scope as a therapist. So getting back into it, fortunately, my principals were very supportive. At the end
Yeah.
of the clinical day, I can discuss a case with them. And yeah, just a really nice supportive environment, I'd say, makes a good working conditions.
Perfect. And you've gone on to really explore the full scope. You've also, won some awards. Talk to us about, what awards you've been winning, and how has that come about? That whole recognition.
Yeah, absolutely. So I was really fortunate to be recognized as the Dental Therapist of the Year for the overall UK and also regional for London. So that was a great experience. It was really great to just connect with people in dentistry because these awards ceremonies happen annually. So um, I think oftentimes in our industry, things can feel quite insular. We're kind of
Yeah.
just going from our practices to home, and we don't necessarily get to connect with the wider dental community. So it was good to just meet new people, reconnect with familiar faces, and yeah, be recognized by the industry. I've worked very hard post qualification, obtaining
Yeah.
my postgraduate diploma in aesthetic and restorative dentistry.
Yeah.
So to be able to put these skills into action, also be recognized, was great.
Yeah. Fantastic. It'll be good to see some of the work that you've been getting up to.
Yes,
So yeah, it'd be great
absolutely.
if you show us.
So yes, they were complaining of the discoloration of their teeth, um, as well as the overall color. So we took some radiographs. We want to make sure that they are dentally fit, no tooth decay, anything like that. They were. So after one session of cosmetic stain removal plus 2 to 3 weeks of teeth whitening, we're able to get this result, which was very nice. I was satisfied. The patient was over the moon, so that was great.
Yeah.
Another case, you can see patient started at D3, was a recently ex-smoker. So
Yeah.
as a gift to herself, she wanted to whiten her teeth. And we can see when we compare that same D3 tab 2 weeks later, a remarkable difference. So again, seeing the patient not being able to stop smiling and seeing that gleam from them makes my day. So
Yeah.
that was really, really rewarding. Um, yeah, so I mentioned about how taking radiographs was really something that helped to steer me forward in seeking out these cases, doing more restorative work. So for a long time, dental therapists could report to on only parts of a radiograph and had to get a dentist to kind of look at different aspects. But upon completing an additional radiography course and changes to the IRMA regulations, we are now able to report completely on bite wings and periapical radiographs without the need of a dentist, so long as you are competent
So
and
these are the different types of X-rays for those that may not be familiar with the term radiographs. So, X-rays that we take within dentistry. Um, this is what Victoria is now getting into in terms of her competencies as well.
yeah, right. So yeah, so through like further study and getting more familiar with, you know, restorative work, I was able to really change my bonding protocols to make sure that if I do a restoration on a patient there, I want the less likely chance for them to have any sensitivity.
Hmm.
As we know, after having the fill-in, sensitivity is quite normal, but we want to try and minimize that as much as possible. So I practice what we call selective etching, where I
Hmm.
may just etch the enamel, and then I'll use a seventh or an eighth generation bond, which has a self-etching properties, which is sufficient for the dentine. If I can isolate with a rubber dam, to give us that nice dry environment that's best for composite, I do. So this is an example of the seventh or eighth generation bond that I like to use. And they're not paying me to say this, so
Yeah.
you know,
It's not sponsored.
it's not sponsored at all. So this was a case that I did. So we can see we've got some caries, some tooth decay here. So isolated with the rubber dam, uh, got my wedges there, my clamp,
Yeah.
and we remove that tooth decay. Practice the selective etching. I build up my marginal ridge first of all, and yep, we go from a decayed tooth to a tooth with a hole to a filled tooth.
Yeah. So there's a lot going on there
A lot
because
going on. Yep.
people think about, why is there a need to know chemistry or biology? Um, in here, you've been talking about selective etching because of the properties of each of the different layers of the teeth, isolation because the type of filling material you're using sticks well in dry areas, and then just knowing your anatomy, how the tooth should actually look so that you can recreate that. You can't recreate what you don't know. So even though you've showed us a single slide, there's a lot going on there that people might not realize you've taken into account to do what you're doing. So, a lot that's going on there to reach the results that you're getting.
Yes, completely. One of the materials that I enjoy using is this kind of SDR bulk fill. So especially if you're quite time consumed or it's quite a deep cavity, we don't have to use conventional methods of building things layer by layer and worry about, I guess, stress on the tooth. We could just fill it all up in one layer, and then the final two centimeters, you could just use traditional composite. So this has definitely been a game changer in my practice, and a material that I always get my principal to order for us. So also air abrasion. So again, this uses aluminium oxide. Just to tie into what you're saying about why we need to have knowledge on biology and chemistry. So this helps to just further roughen the tooth, give us a greater surface area, which is going to help make our fillings last and stick nicely onto that tooth surface. So this was a case that I did. She actually just came in for a hygiene appointment, and through just discussing, she also mentioned that she wasn't happy with that filling that you can see on that front tooth, which stands out quite a lot. So she had hit her tooth during childhood, and the dentist just put a quick filling on there, and she never really went back to get it replaced or anything like that. So what we did again, we isolated with rubber dam, we removed the old filling. You can see that nice matte appearance on the tooth. That's where we've used the sandblaster or the aluminum oxide to give
Yeah.
that nice, matte appearance. It's going to help things stick nicely. We can also see that side profile there, with a bevel to increase our surface area. And here, what I've done is just try to recreate some mamelons, so some of the anatomy, as you mentioned, of the tooth to give a more of a realistic appearance. So we started off here, both the upper left one, upper right one. We can see we've got discoloration, some pitting, and a mal-aligned filling, and it projects out. You can see on that side profile.
Yeah.
So we're able to take that and give us a nice smooth finish. We're able to correct that projection, which she was really pleased about. I think at first her main concern was just the appearance of it, but when we were able to really change the profile of it, she also
Yeah.
said that I love how it doesn't stick out, which was not something she initially took much notice of. So again, very happy patient. Happy clinician. So again, just a few more photographs of that case.
And would you say that this was something that you were able to do after 3 years of study at Manchester? You just came out and you were able to then apply all of this to carry out this type of work.
Wouldn't that be great? I wish that could be the case, but no. So with most courses, same with BDS dentists and dental therapists, you leave university being able to be a safe beginner. That's the most important thing. We want to be able to treat patients safely, but doing this type of work, I was not producing it when I first left university. So again, case selection when you first qualify is really important, and post-qualification courses I would recommend. So whether that's a short course, there's very great 2-day composite courses you could go on, as well as more extensive courses, which I did, which was the postgraduate diploma, which was a year long. And it just aids with confidence, aids you with different techniques that you can use to get these results. Small things like even polishing protocols, which in university you don't really go through that extensively. The main aim is to make sure that a restoration is functional, free of any edges or ledges. But there's a real art to a polishing protocol. So if I'm really going to go to town, polishing can take me anything from 20 to about 20, 25 minutes if I really am going for it. So yeah,
Yeah, so the learning doesn't stop after the three
absolutely not.
years.
No, not at all. I've just got another case to share. So this is just another profile of her. You can see that before and after.
Big
Um,
change.
Yeah. And another thing, photography is also really important in dentistry. I joke to my patients all the time that, I'm a part-time photographer because I spend so much time taking photographs.
Yeah.
So these photographs I actually took quite early on in my photography journey. So they're not as clear as my photographs now.
Mm.
But another thing, it may be worth to go on a photography course, one that's tailored to dental therapists or dentists. So dental photography is its whole ball game. Again, something that's not covered in the course, but the learning doesn't stop, so
Yeah.
probably want to get on a
And
course.
with the photography, what's the benefit of the dental photography for
Yeah,
you?
so for me, it's a great communication tool for patients. So if
Mm.
I had another case come in and said, I'm not happy with a filling at the front, I can just clearly show, well, this is something that I've done before. So I may
Yes.
be able to achieve similar results in your case. It's good to document things as well. If you've got nice, clear before and after photographs for the patient's sake, for your sake. And also, we see social media has become quite a big thing.
Mm.
So showing your work, demonstrating it for colleagues, prospective patients and current patients.
Yeah,
Yeah.
yeah. And
Mm.
what I find for myself is when I've taken time to take photographs befores and afters, it gives me a chance to critique my own work.
Absolutely.
Otherwise, you've done the case onto the next one, and you never really learn from things that didn't go so well or things that did go well.
Yeah.
So I found that I'm critiquing myself with the photos that I'm taking. That's helping me develop so that I don't make the same mistakes in future
Yes.
cases, and that things that came out really well, I'm like, okay, I need to do that more of that in future cases. So there's a
Yeah.
lot to photography being
Yeah.
beneficial.
Yeah.
Yeah.
It can be a double-edged sword, I must say, because sometimes you can leave a case thinking, oh, that went well. And then you look at the pictures, you're like, okay, I know it was functional. I know that it was ledge free, but I could have got that marginal ridge a bit more, detailed.
Yeah.
I could put more detail into that fissure. But hey, I always say dentistry is half science, half art.
Yes. Yeah.
So another similar case. So this patient hadn't been to dentist in quite some while because she had quite severe dental anxiety. She had a lot of caries or tooth decay that needed addressing. So the first thing that we did was stabilize her, gave her a diet sheet, make sure that the oral hygiene was where it needed to be.
Mm.
You can see clearly that decay on that upper left one there. And she also had hypodontia. So she's actually missing her lateral incisors. So she had braces in her adolescence to move her canines to the position of her laterals. And then they were shaved down to kind of disguise to look like lateral incisors. So here we can see where she has her fixed retainer from her childhood orthodontic or braces, and we can see that caries right underneath that wire.
Yeah.
So what we did, we took it all out so I could get a nice clear view. And then we started the process of cleaning it out. So I like to use disclosing solution because it's quite good just to make sure you've got all the bacteria off. That's going to yield to a nice clean surface and that's going to get your best bonding with your materials to that tooth surface. After that, we can see we removed the bulk of the caries. So because this was a stabilization case, the main thing we wanted to get her stable. It wasn't completely about aesthetics in this case. So we can see we've got a little bit of that stain dentin, but that's not anything that's going to cause any harm. It's just staining and something we can address in the future. So we were able to go from removing all of that decay and that failing fixed retainer to a nice clear surface, all with composite.
Yeah.
So you
Number
can,
three there.
Yeah.
what was a hygiene and therapy thing to do, the disclosing to readily use that. That's I know how many dentists are thinking about that in the back of their mind. I'm going to use disclosure just to make sure that the surfaces. That's good to see
Super clean,
because
yeah.
I'm learning as well, and
Yeah,
it's something easily done, which
absolutely. I
can
think,
just add to
yeah,
your cases. Yeah.
as hygienists, we're often talking about biofilm and the importance of plaque. So it's just kind of like second nature. Let's just get some of that disclosure solution out. But yeah, I definitely recommend it to everyone.
Good to
So
see.
yeah, we can see the before and the after. Small difference, but big difference at the same time. She
Mm.
could not stop smiling with that mirror. And again, that just fills me with so much joy. And reminds me why I got into this is to improve people's lives, confidence through these small little changes. And again, just a side by side facial profile, quite a big
Yeah.
difference. Mm.
Fantastic. Yeah, no, that's really um, good variation and range of treatments that you're getting to carry out there, skills that you're showing in recreating anatomy and photography as well, and just cosmetic results for your patients to increase their confidence with their smiles. So it's amazing to see what you can do and achieve through your scope of practice. It'll be good to get your advice for people that have just qualified
Mm,
and they want to utilize their full scope.
mm.
Um, what would you say for finding? So let's say you have gone through the year of foundation training, um, and you want to continue to progress in using your full scope. Just talk to us about the practicalities of finding the jobs. Um, are there things that you have to negotiate? And then we'll even go into things like, are you self-employed? Are you employed? What are the realities?
Yes. So, very good question. Fortunately, things have changed so much from when I qualified with regards to the opportunities for dental therapists. There's a lot more. I think changes with the NHS system, which allows us as therapists to open up courses of treatment without the need of a dentist to open one first. We've got our personal NHS numbers now, so opportunities are a lot more greater, thankfully, than before, which is good. If you are in a practice where they don't necessarily have a therapist, it's just dentists and they're just using your scope as a hygienist, I think the first thing I'd recommend is just having a conversation,
Mm,
letting the associates and the principals know your scope because a lot of our colleagues are unaware of what we can do. A lot just think, we do perio or gum disease treatment and it stops there. So I'd say just having that conversation and express a desire to do more of that.
yeah,
I'd also recommend documenting your work. So even if it's just a small fissure sealant that you do, just take photographs, start small. Have conversations with patients as well. So during those hygiene visits, just open up the conversation. If you notice a bit of wear or a little bit of discoloration, just bring it up. Take two shades as well during the hygiene appointment just to open up that conversation. Um, I would recommend when it comes to finding work or when you're applying, making it very clear that you're passionate about restorative work. So when it comes to interview, again, you can slip that in and speak about your desire to do more restorative work.
yeah. And do
Mm.
you find that the job roles are employed job roles, self-employed job roles? What's the status like for therapists?
Yes, so most roles are self-employed. That's both
Okay.
for hygienists and therapists. It really varies on how practices work with remuneration. So some will work on a percentage basis on so you get a percentage of the fee of treatment. Some it's an hourly rate, but it's still on a self-employed basis.
Yeah.
Some it is employed. So it really just depends on where you're working,
Mhm.
type of work that you're doing and the kind of setup that you have.
Yeah.
Um, yeah, and what works for you in your situation.
Okay. And then I guess one of the final things I'd like to ask is you're looking for um, where to work. You've done your 1 year of foundation training, and you've got quite a few places you could accept
Mhm.
for a job role. Are you looking more at the type of percentage that you're getting? Are you looking more at the scope that you're going to get to use? Are you looking more at the equipment? or the people that
Mm.
are there? Like, well, what are you considering? What's going to weigh heaviest in you choosing a place?
Yeah, those are really good questions. I think very early in your career, the main focus should be building your confidence, building your skills, and being in a positive working environment that you feel you can grow. So that would
Mm.
be priority for me. So if I'm working in a place where I know the principal and the associates are pro therapists, I know that I can ask them any questions without any fear of criticism. That's
Mm.
going to be very high on my priority list. If there's going to be an opportunity to really use my scope as well, that's going to be high on my priority list.
Yeah,
These courses that we speak of, they're very valuable, but they're not cheap. So you want to
yeah,
make sure that there's some form of return in your investment. So
yeah,
those would be the things that I'd be looking at firstly.
yeah,
Remuneration and money will come down the line. So I think if you're quite newly qualified, that should be the main priorities. You can always
yeah.
negotiate that down the line. And the more experience that you have under your belt, the more you're using these skills, the more valuable you are in a sense. So you can negotiate that even if you were to move on to a different practice.
Fantastic. And are there any spaces where therapists and hygienists get to meet or interact, connect? Are there any you've been to that you'd recommend for people in that situation looking to connect with others?
Yes, absolutely. So, we've got the British Society of Dental Hygienists and Therapists. So, they are the biggest, I guess, professional body that we have for therapists and hygienists, as well as the
Mm.
British Association of Dental Therapists as well.
Yeah,
So, with the first one that I mentioned, BSDHT, they have an annual conference or oral health conference every year in
yeah,
different places in the UK. One year it was Bournemouth. It's been in Harrogate a few times. So that's a great opportunity to really connect with different therapists.
yeah,
They also have regional meetings as well. So there's one for like, Southwest, Southeast, London, and they
yeah,
meet every so often. So I think it's really important, as I said, in our profession, as rewarding as it can be a bit isolating. So
yeah,
being able to just speak with people in your situation
yeah.
and listen to what advice that they have, and you just continue to learn from each other.
Fantastic. And do you find time to do other things outside of work? Because it looks like you can be quite busy.
It can be very busy, but I think you need to have a good work-life balance, which I'll be honest, I don't always I'm not always the greatest at. I think
Yeah,
especially when there was a time where I just wanted to learn and just do so much. Sometimes I'd be leaving like an hour and a half to 2 hours after my clinic had ended.
yeah,
But I've become a lot more strict on myself. So yeah, just fitness groups to get
yeah,
those endorphins pumping,
yeah.
swimming, trying to just stay active, I think is really good. And just knowing when to switch off. It's hard, but yeah, knowing when to switch off.
Fantastic. Well, no, thank you very much for everything you've shared today. I know it's going to be valuable for those thinking about getting into being a dental therapist, for those that are currently in uni and just thinking about getting to the end of that and what to look forward to, and even for those who have just qualified and are looking to really progress with the careers. I'm sure everyone in those categories is going to find some value in this chat today.
Yeah.
So no, thank you for that. If people want to reach out to you, just ask questions, what's the best way to do that?
Yeah, sure. I'd say follow me on Instagram, which is Vic Smiles. Drop me a DM. I'll be happy to help where I can.
Yeah, perfect. Thank you for that.
No problem. Thank you so much for having me.